Thank you so much, ECA, for inviting me here. It's a pleasure to be with all of you. Vera, congratulations on organizing this Africa Business Forum. Those of you here who know me, you know my activism for many years and my commitment to social justice. You know that I believe in health as a right, not as a privilege of the rich. It can never be a privilege of the powerful. It's a human right, and it belongs to all. That's why UNAIDS is committed to join efforts to expand, to frame and leverage partnerships with the private sector. But we must, and it's a big but, we must always do this carefully to ensure that the contribution of the private sector is to help and to ensure that that right is achieved, that access to the critical health services that everyone needs, everyone gets. So I'm convinced that publicly financed health care is the greatest equalizer in society. Yet, there is no health system that's entirely public. The private sector must play its appropriate role. The first role of any responsible business that cares about human health is to pay its fair share of taxes so that our governments can invest in services that work for everyone. How can we complain about crumbling government services when our economy is set up to deny them funding? It's also critical for businesses to look after the well-being of their workers, pay them fairly, look after them well, because poor working conditions are a leading cause of ill health. Another role of the private sector is to drive innovation and to contribute to shaping financing mechanisms that can truly crowd in more resources to support our health systems. That's another role. Your voice, business, as actors in society who care for those who are left behind, is also important. Your voice is important. But let me also share with you a concern. We've witnessed a tidal change in the level of interest in healthcare markets in some African countries. That's good, but not all of it is good. The rationale is often that people are already paying out of pocket for health care, that there's a rise in non-communicable diseases, that there's money to be made from medical tourism, and with inequality, there's also a growing number of people at the top who are demanding for super specialty care, and some of them can afford it, of course. So equity investors are coming. Some are investing in private health care. Companies are fattened and sold on to the next highest bidder. Profits extracted out and sent to tax havens. And we are left with the international health standards of healthcare for a few, and even less and less for everybody else. Some of you may have read in the news last week of the Lesotho PPP hospital. It has been in the news for a couple of years. It's a contract that's draining government coffers and threatening access to the only tertiary hospital in that country. I've researched it. I've spoken many times with the World Bank about it. Governments should not take unnecessary risks with limited public revenues. Governments should be careful. The world has committed to bringing down out-of-pocket spending on health, but out-of-pocket spending in Africa is going up, not down. Such spending is a leading cause of poverty in many countries. We mustn't sit here to plan how to profit from this kind of failure, but sit here to plan how we can build strong, universal public health services that benefit everyone. Let's do differently. Let's do things differently here in Africa. Let's work together to support universal health services that work for the poorest upwards. Let's work in favor of innovation. But remember that innovation is not an exclusive domain for the private sector. We don't need to look very far to see examples of innovation in the public sector. Here in Ethiopia, under the excellent leadership of my friend and colleague, Dr. Tedros, the Director General of WHO, when he was here as the minister, tens of thousands of community health workers were trained and deployed in the shortest time, and that cut child deaths from malaria by a half. That's innovation. And why don't you clap for that? Thank you. Yes, thank you. There's innovation in the public sector too. As we speak, African governments are signing up for and are going into serious debt because of expensive contracts, partly because of, not only because of, expensive contracts with international medical equipment firms, international firms, and they're having now, in restructuring debt, to increase user fees for patients in order to help pay for loans that were borrowed some time ago. People are paying back, poor people are paying back for these loans, and they are for contracts that locked out benefits for African businesses. They are paying over the odds for medicines and supplies shipped in from outside. We need to respond to that. I'm happy to hear that we are making tremendous effort. Commissioner, I'm happy to hear that you're working hard to make sure that we nurture homegrown generic medicine manufacturing to lower the costs our governments are paying, to generate jobs for our youth, and to reward our own African businesses. Well done. We need to listen to our own public service leaders and work with them to develop low-cost solutions that can transform their capacity to deliver to the poorest people. Businesses have a key role to play to deliver on the right to health care. The right to health should be the guiding principle. Friends, let's remember that Africa can be stronger and fairer if we put all our people's well-being and access to quality health care first. Let's remember that the majority of our people are in danger of being left behind if we only seek to support those who are seeking profits and who will take it from those with cash in their pockets. We have to remember millions of our people have no cash in their pockets to pay for health. So let's come together, governments, businesses, put our best foot forward to guarantee that every girl, every boy, every woman, every man has their right to health. I thank you.
Next.